Imagine waking up one day and feeling like the world around you has changed. You hear a whisper when no one is there, and you feel like someone is watching you, even though you are alone. Sounds terrifying, but for people with schizophrenia, this is the real. Schizophrenia is a complex mental disorder that affects millions worldwide. But what exactly is it? What causes it? And can it be treated? Let's break it all down today. Schizophrenia is a mental disorder that affects a person's thoughts, emotions, and behaviors. It can cause them to lose touch with reality, making daily life difficult. It is not the same as multiple personality disorder. It does not mean someone is violent or dangerous. It is not a rare condition. Over 24 million people worldwide have schizophrenia. Schizophrenia usually appears in late teens or early adulthood and affects men and women equally, but men tend to show symptoms earlier. Schizophrenia symptoms are divided into three categories: positive, negative, and cognitive. Let's break them down. Positive symptoms, adding to reality. These symptoms make the person experience things that aren't real. Hallucinations, hearing voices, seeing things that don't exist. Delusions, false belief. For example, thinking they are being followed or that they have a special power. Disorganized speech, talking in a confusing or illogical way. Disorganized behavior, acting in unusual or unpredictable ways. Negative symptoms. These symptoms make a person lose their normal abilities. Lack of emotions. Blank facial expression, no change in tone. Social withdrawals, avoiding friends and family. Loss of motivation, finding daily tasks difficult. Difficulty speaking, speaking less or using short, simple sentences. Cognitive symptoms affecting thinking and memory. Trouble focusing on conversations or tasks. Memory problems, forgetting what was said moments ago. Difficulty making decisions. What causes schizophrenia? Schizophrenia doesn't have a single cause. Scientists believe it's a mix of genetics, brain chemistry, and environmental factors. Genetic factors. If a person or sibling has schizophrenia, the risk increases. However, having a family member with schizophrenia doesn't mean you will develop it. Brain chemistry and structure. People with schizophrenia have an imbalance in dopamine, a brain chemical that affects mood and perceptions. Brain scans show differences in brain structure in people with schizophrenia. Environmental triggers. Stressful life events can trigger schizophrenia. Substance abuse, especially cannabis, LSD, or meth, can increase the risk. Schizophrenia is not caused by bad parenting, personal weakness, or supernatural forces. How is schizophrenia diagnosed? There is no single test for schizophrenia. Doctor use medical history, interviews, and behavioral observation. Symptoms must last at least 6 months for a diagnosis. Doctors rule out other conditions like bipolar disorder or drug induced psychosis. How is schizophrenia treated? The good news: schizophrenia can be managed with proper treatment and support. Medication. Antipsychotic drug reduce hallucination and delusion. These medicines must be taken regularly. Stopping them suddenly can cause relapse. Therapy and counseling. CBT, cognitive behavioral therapy, helps people recognize and challenging false beliefs. Family therapy helps families understand schizophrenia and provides support. Social support and lifestyle changes. Maintaining a daily routine improves stability. Avoiding drugs and alcohol is important. Support from friends and family makes a big difference. Recovery doesn't mean curing schizophrenia, but learning how to live well with it. Myths versus facts about schizophrenia. There are many myths about schizophrenia. Let's separate facts from fictions. Myth: people with schizophrenia have multiple personality. Fact: schizophrenia affects perception, not identity. Myth: people with schizophrenia are violent. Fact: most people with schizophrenia are not violent. They are more likely to victim of violence. Myth: schizophrenia is untreatable. Fact: with treatment, many people live fulfilling lives. How can we support people with schizophrenia? If you know someone with schizophrenia, here is how you can help. Be patient. Symptoms can be difficult to manage. Listen without judgment. Make them feel safe. Encourage treatment. Support them in following their treatment plan. Educate yourself. Learning about schizophrenia reduces stigma. Schizophrenia is challenging, but with the right support and treatment, people can live meaningful lives. Let's break the stigma and create a world where mental health is understood and supported. If you found this video helpful, please like, share, and subscribe. Together, we can spread awareness and support those in need.